All right, and 3, 2. Gabriel, thank you for coming on.
My pleasure, Rick. It's a pleasure to be here.
I want to start off right away is that we'll get into what you do. I'd asked you for what we're going to talk about, and you're a clinical psychologist. And
No, sorry,
sorry,
that I'm not a psychologist. I'm a registered clinical counselor.
but you're a registered clinical counselor.
Yeah.
And I had asked what we could cover, and I remember the conversation was through text, and what came back through text hit me when I looked at it, and you went right to the heart of the matter, and you wrote self-hate, and part of me wanted to. I felt, oh no, that's too real. No, can we not make it more gentler? And then I thought about it. I'm like, no. Self-hate's going to be perfect. That's exactly what we should get into. So let's go back to the beginning. So you are a clinical registered.
So I'm a registered clinical counselor. So I offer psychotherapy. I have a master's in clinical counseling. And then my school of thought, the one that I chose, is psychoanalysis or psychodynamic therapy. I offer there's other theories or schools of thoughts that I'm interested in. I also applied, which is attachment theory, and on a practical approach. Solution focused, but basically it's really what I'm interested in psychoanalysis.
And why are you interested, or we're interested in that?
Right. Well, many reasons. One is that that was the theory. I'm originally from Argentina, and over there it's very common to at some point go to a therapist. It's a cultural thing. There's no taboo. There's no stigmatize. It's not stigmatized as it is, for example, here. People just find it as common. Actually, when you don't go to a therapist, they wonder why.
I remember you had said that before, and I had laughed because it was like someone might say, "Oh, I'll meet you after therapy," or here we say, "Yeah, I'll meet you after yoga."
Right.
Or
exactly.
gym.
Over there, it's after therapy or before therapy. Yeah. And so psychoanalysis is actually, it's the country that has the biggest amount of psychoanalysts in the world. I think the other one is maybe France. New York is another big city but Argentina is one of the biggest. And that's where I ended up going to, a psychoanalyst. And so I did it for many years, and I understood that there is an unconscious mind. There's an unconscious part of our mind, things that I wasn't aware of, and now I am. So I understood that that's the type of approach that I was interested in once I decided I want to do that.
And through your work, you discovered that people had self-hate, or you went into it knowing that's what it was?
Well, it's one of the main, I won't say that's the thing, but it's very common when somebody approaches me for help, for therapy. They start to tell their story. I ask questions, and usually I can see that it all involves around those demands that they have on themselves. I'm not good enough. I should do better. I'm not working enough. Or they're working too much and they can't stop because they're afraid that if they do, they're going to be judged by their peers, by a supervisor, that their partners are thinking that they're not good enough, or friends, or it's so they live with those that torture voice, that inner voice. And so it's a very common theme in therapy.
And during that process of listening to them, Are there certain key elements that you're listening for that it's going towards? Is there are there key words that you're picking up that you're hearing? Okay, this is where we're headed with this person.
Well, usually, yeah. Depending on what is the, sometimes usually people come with something. I have this problem, and it's been going on for years. They notice it doesn't go away, and it comes back and back, and that's in psychoanalysis that's called repetition compulsion. Compulsion to repeat something that comes back. It's a theme that comes back over and over. Oh, I always choose, or they don't say I choose. I always end up with the wrong partner, someone who doesn't really appreciate me, or uses me and then abandons me. It's always I never find the right individual. And so at some point they say, well, maybe it's not them, maybe it's me. That's why they go to therapy, because they realize it's happening too often. At some point they realize maybe it's not the other one. Maybe I'm choosing the wrong people. Why am I choosing the wrong people? What makes me want to choose the wrong people? And so that's where it starts with that, but the conversation can then, and especially in the type of therapy that I offer, there's layers. We're complicated. Human beings, we're complicated. There's layers to our behavior. And that's where the unconscious mind comes in, because it's not that people wake up in the morning and say, how can I make my life more miserable? How can I complicate it and just make myself suffer? They don't do it on purpose. Something makes them be in that place.
And does that go back back to the childhood?
Most likely, yes, because life starts even before you're born. Your parents thought something about that unborn, even before, that mother, when she was a child, she was thinking, the day I'm a mother, I'm going to have this kind of in her fantasies. So life starts even before you exist, because somebody, before they had you, had something in their mind of what type of children they want or did not want. Because if you're an accident, if you were not wanted by that mother or father, then it's not going to be the same as somebody who is born from someone who is wanted.
Wow.
Yeah.
That's really deep.
Yeah.
You went pretty far back. I didn't know you were going to go that far back.
Well, there's layers. That's when somebody comes with a problem. You start digging in, they discover, oh yeah, but it's related to something, and I remember, and I see that, and so there's more, and more things come up, if you want to. Now, there's different approaches to therapy, so you can dig a little deeper, deep psychology, they call it, psychoanalysis, or you could keep things on a superficial level and just cope, which is, some people, that's all they want. I want to cope. I don't want to go scarving into my past and conflicts and things that for me are just too painful. I don't want to go there.
But we don't make a conscious decision, do we, that we just want to cope? We just say, this is life.
Well, I don't know if it's a conscious decision. Oh. It could be a conscious decision. I want to cope. I want to, people don't say, I want to cope. They come and say, I want to feel the way I was feeling before I started feeling this way. Like I have a lot of anxiety. I have depression. I'm depressed. I don't want to get out of my bed. So those are symptoms. And some people say, I'm feeling this. It doesn't go away. Help me. And so there's different approaches to therapy.
And so that leads into the next question. And